I'm very proud to be announcing that today we will ensure that the price of medicines is cut even further. I came to office committing to reduce the price of medicines from $42.50 down to $30 that were on the Pharmaceutical Benefits Scheme. What we have announced today is that from 2026 that will be reduced further down to just $25. This is cheaper than at any time since 2004, making a real difference to cost of living whilst also putting that downward pressure on inflation. And I also have an important message today. The Pharmaceutical Benefits Scheme is a source of pride for Australians. It is not up for negotiation, and it certainly is not up for sale. It's something that guarantees that people can get the assistance they need through pharmaceuticals when they need it at a proper and affordable cost. We have also frozen, of course, the costs of pharmaceuticals under the PBS for concession card holders and pensioners to just $7.70 up to the year 2030. What this means in practice is that had we not taken the action that we have, the price of medicines would have been $55 rather than just over $25 in 2030, less than half as a direct result of these measures. Labor will always defend the Pharmaceutical Benefits Scheme, just like we'll always defend Medicare. If you look at the policies that we are proposing for our second term, they are across the board looking after people's health, whether it be making it cheaper and more affordable to see a GP by tripling the bulk billing incentive for all 27 million Australians that we expect will see over 90% of Australians seeing a GP for free. All they will need is their Medicare card, not their credit card. The additional 50 urgent care clinics adding to the 87 that we've opened already, making an enormous difference for Australians. I was at the one just up in the Caboolture region just the day before last, making an enormous difference. More than 1 million Australians have seen someone at a Medicare urgent care clinic, got the care they need when they needed it, and all they've needed is their Medicare card. So seeing a doctor for free at the GP, seeing a doctor for free and getting the care they need with urgent care, being able to have affordable medicines. These measures combined, in addition to the $1.7 billion of additional investment we put into hospitals in the coming year. It stands in stark contrast with what happened the last time Labor wasn't in office, was of course 2014. There we saw $50 billion ripped out of public hospitals. We saw an attempt to impose a GP tax every time people visited a GP. We saw an attempt to visit an emergency department tax every time people ended up in a hospital, and we saw legislation introduced to increase the costs of pharmaceuticals by $5, not decrease it. All of that happened, of course, on Peter Dutton's watch as the Health Minister. So we need to look at what people do, not just what they say. What Labor does is talk about healthcare, talk about the importance of Medicare, but most importantly, take action to defend and strengthen Medicare. That is what we are doing with today's announcement, and I want to pay tribute to the Pharmacy Guild and to our pharmacists who go out there and provide that advice, that healthcare for their patients. They have a one-on-one relationship with patients in their local community that is second to none, and they provide such enormous support. And I pay tribute to them not just for advocating in the interests of their business, but importantly, what they do is continue to advocate for the people that they serve. And for that, They deserve enormous praise, and I was very proud to be able to make the announcement in front of thousands of pharmacists here on the Gold Coast this morning. We're going to hear from the Health Minister, then we'll hear from Trent Toomey, then we're happy to take questions.
Well, thank you, Prime Minister. Thanks, Trent, for hosting us at APP. Again, a huge conference bringing together the nation's community pharmacy owners. As the Prime Minister has said, cheaper medicines are a terrific policy, partly because they're good for the hip pocket, and they obviously are at a time of real cost of living pressures, but they're also good for the health of our country, because we know cheaper scripts are more likely to be filled by patients when they're dealing with a whole lot of pressures on their household budget. Without the measures we have put in place as government, the maximum price of a PBS medicine next year would be more than $50. If we're elected, it will be half that at $25. A huge benefit for Australian households and a huge benefit for the health of our country. This will be the 5th instalment in the cheaper medicines promise that we made at the last election, already saving Australians more than $1.3 billion at the pharmacy counter. They've been strongly supported by the Pharmacy Guild, and I want to thank them for that. I have seen, though, some comments from Peter Dutton that he will reflect or back in the promise that we've made over the course of today. And I just, as the Prime Minister has done, caution Australians not to look at what Peter Dutton says, but look at what he did. As he was becoming Health Minister 10 years ago, he said there'd be no cuts to health, and then when he was elected, tried to jack up the price of scripts by $5 a script. When we brought cheaper medicines to the Parliament over the last couple of years, he voted against them. As we've put instalment after instalment in place of cheaper medicines policies, the Liberal Party has consistently described them as wasteful spending and said that they would be on the chopping block if the Liberal Party were elected to government. So this man has form in this. He's got to be accountable for his record, and I caution Australians not to look at what he says today, but to look at what he's done over a long career of favouring an American-style user pay system in health rather than the universal healthcare system that Labor has built in this country. I've also seen some comments about the PBS over the course of the last few hours. Let's be clear about the historical record. When the Howard government was negotiating the free trade agreement with the United States, Big Pharma in America tried to do exactly what they're trying to do today, to put pressure on our Australian PBS scheme. And the Australian Labor Party insisted that there be amendments put through the Australian Parliament that would secure our PBS. They were opposed by John Howard. They were opposed by the Americans, and they were opposed by John Howard, who backed in American industry over the interests of Australian patients. So don't let the Liberal Party try to rewrite the historical record. The only reason there is legislative protection in the US Free Trade Agreement for our PBS is because of the insistence on the part of the Labor Party. Only the Labor Party can be trusted to protect the PBS in the current climate.
Thank you, Prime Minister. Thank you, Minister. Pharmacists of Australia are exceptionally proud to partner with over 20 different national patient groups to work with the government to deliver on this initiative. The Australian Bureau of Statistics told us that 1 in 5 Australians were delaying, deferring or going without getting their medicine dispensed because of price. And this rose to 1 in 3 Australians in regional, rural and remote locations, and in fact 1 in 3 women. So what this proposal will do is it will take our PBS down the right path. Before this government's initiatives to lower the price of medicines, we had the 3rd highest out-of-pocket expenses for medicines in the developed world, behind the United States and Switzerland. We only have a universal healthcare system in Australia if we have a universal PBS. Before these reforms, 51% of medicines cost a different price depending on what brand of pharmacy you entered. 51% of medicines cost a different price depending on what postcode in Australia you lived in. After these reforms come into fruition in 2029, 71% of prescriptions will be the same price no matter which pharmacy you choose to go to and no matter which postcode you live in. Pharmacists are trained healthcare professionals to have a conversation with you and your family about the healthcare advice that you need. We are not trained financial advisors to give you advice on the family budget. We know we're in a healthcare crisis, but this investment does not stay in community pharmacy, it flows through community pharmacy. Every dollar that the taxpayer is investing in this flows directly into the hip pockets of Australians. So thank you, Prime Minister. Thank you, Minister, for returning the principle of universal access to medicines in Australia.
Thanks very much. Happy to take some questions on this firstly.
Prime Minister, are you disappointed the coalition is neutralising your health announcements by immediately matching them?
Well, you have to look at what they do, not what they say. And before the last time that government changed to the coalition in 2013, they famously said no cuts to health, no cuts to education. The budget papers are there for all to see. $50 billion cuts to health, $30 billion cuts to education, attempts to bring in GP tax, increase the price of pharmaceuticals, and when that didn't succeed, freezing of the GP rebate for 6 years, which saw bulk billing go into freefall. Labor believes in Medicare as the central heart of our healthcare system, and then the arteries flow out, including the PBS as being absolutely critical. Labor created the PBS under Curtin and Chifley and has defended it ever since and always will. Labor created Medicare under Bob Hawke and will defend it and always will.
Prime Minister.
What will you do if Trump threatens tariffs over pharmaceutical exports because of the PBS?
We'll stand our ground. This is not for sale and is not up for negotiation. This is a part of the free trade agreement because Labor insisted as a condition of our support for the free trade agreement. So the Pharmaceutical Benefits Scheme is a part of who we are as Australians, and we will always stand up for it. It's not up for negotiation.
Do you think Minister, the PBS is actually not it is a scheme of negotiation whereby the Australian government buys medicines from the US. The free trade agreement has nothing to do with medicines listed on the PBS. Are you not starting a PBS scare campaign, and how are you going to protect Australians from higher price for medicines when we negotiate the price through the PBS?
I didn't write the article on the front page of the paper, with respect.
I think it came from my article, actually.
Well, you wrote the article, so you're running the scare campaign, apparently.
I did not write that one. I wrote one out that they took it from, but the PBS isn't a scheme.
The PBS, we will defend the PBS, and we won't be negotiating over the PBS.
But you do negotiate
we
over
will not.
medicines on the PBS.
Can I get to answer? We will defend the PBS. We will not be negotiating over whether we have the right here to put pharmaceuticals onto the PBS. That is what we will do.
Just back to US tariffs, do you think that there is any room to get an exemption if they were imposed?
Look, we'll continue to put Australia's case. Tariffs are an act of economic self-harm. They increase the price at the point in which sale or purchase of Australian goods occurs. And that is our position. We've put it forward very strongly. The United States enjoys a 2-to-1 surplus. That is, they sell twice as many goods in value to Australia as we sell to the United States. Therefore, the imposition of tariffs is certainly not in the interests of the United States, and obviously it's not in the interests of Australians either.
I've got one more on PBS.
Sure, and then
the Australian Labor Party posted this on Instagram. We're just wondering your thoughts on it.
Oh,
The Medicare.
I'm not going to look at a video. What's that? We think that's a reasonable figure that we worked through with our cabinet process and with as well with the Pharmacy Guild. We're pretty happy with that figure. We think that the reduction in price from $42.50 down to $30 made a difference. This will make even more of a difference.
Prime Minister, what did you make of the treatment of women, those allegations that surfaced from that 60 Minutes report?
Oh, they were appalling.
Just on salmon farming, if that's okay. What changes exactly will you make to the Environmental Protection Act to ensure salmon farming is guaranteed in the Macquarie Harbour?
Well, people will see the legislation next week. As we committed to introduce, we'll be introducing it, and we expect it to be carried.
In the PBS, will there be transparency in how you fund the PBS, given this is another cost? And how is it not inflationary when you're putting money into people's pockets?
Well, we've seen Treasury talk about measures like this before over the last few years. This has reduced the price of medicines. Measures like cheaper childcare, we've designed these very carefully to put downward pressure on inflation, as the Prime Minister said in his speech.
Just a question for the Prime Minister. While millions in northern New South Wales and southeast Queensland were bracing for Cyclone Alfred, you attended a fundraiser, just like Peter Dutton, who Labor attacked for doing the same. How do you justify that?
Now, I travelled to Queensland on the same day that Peter Dutton travelled away from Queensland.
But on March 4, you attended the fundraiser.
I travelled away from Queensland on the same to Queensland on the same day that Peter Dutton left Queensland.
Prime Minister,
Thank you.
Just on a local issue.
Sure.
On the light rail, will you support extending the light rail to the airport?
There's a business case needs to be conducted. I'm someone who, as Infrastructure Minister, put $365 million through the federal government into the Stage 1. That was opposed by the LNP, state and federal. Steve Chobo and local federal members went out there and collected petitions against it. So what we did was make sure that the Gold Coast Light Rail project got done. And that was important, not just for residents of the Gold Coast, it was important for the success of the Commonwealth Games, and it's important for all the visitors who come to this fantastic region of Australia where tourism plays such an important role. Thank you.
Just one for the Olympics.
Thank you.
Thank you, Prime Minister.
Of that EBS and that capping over time. We'll have more on that in the coming hour, as well as an update on the opposition leader Peter Dutton speaking to media and giving a speech rather on foreign policy at the same time. We'll have a full update. But meanwhile, while the Prime Minister's been speaking, the latest jobs data has been released by the Bureau of Statistics. Finance presenter Sam Yang is here now with all the details. So Sam, just what are these numbers telling us?
So Dan, Australia's unemployment rate remained steady at 4.1% in February. So that's in line with the consensus. So in January, we saw that number was 4.1%, so that it's steady. However, nearly 53,000 jobs were lost from the economy in the month, well below expectations for 30,000 jobs to be added into the economy. And that was as fewer people were in work or looking for work, with the participation rate falling to 66.8% from the January record high of 67.3%. So that's largely due to a smaller number of people looking for work or working in the labour force. And when we look at the reason that the ABS has given is that there's a new trend happening. So for the month of February, fewer older workers returning to work in February contributed to the fall in employment that month. And in contrast, ABS says we continue to see growth in younger people being employed. So that's an interesting trend there pointed out by ABS. And when it comes to employment to population ratio, it actually fell 0.4 percentage points to 64.1%. So that's after 64.6 in January, which was at a record high. So a bit of surprise, I suppose, to a lot of economists in terms of the jobs growth. For more, I'm joined now by Adelaide Timbrell, senior economist from ANZ. Hello, Adelaide. Welcome to the news channel.
Thanks for having me.
Any surprises for you there?
Yeah, it's a big surprise in the sense that we did see a fall in employment. The market and our forecasters here at ANZ were expecting a pretty solid rise, but that did come out of a fall in the participation rate. We have seen an absolute spike in the number of people who were either looking for work or in work in the last year. This has come back a little bit. It's still high relative to the long run average, but has come down from 67.3 to 66.8. Even a 0.1 percentage point change here is pretty big in terms of the number of jobs in the economy. We don't have the data on this, but I suspect there's a few less health workers through this month than there has been in the past, because that was one of the big industries where we saw that lift in participation flowing through to the workforce. Still, an unemployment rate of 4.1% says that the labour market is tight, the economy is still looking healthy from a labour market perspective, and it's not going to encourage any Reserve Bank moves in the short term.
Yeah, Adelaide, a lot of economists dubbed the January report as a hot jobs report, and ABS has given the reason that because there is a bit of a seasonal factor in play there. And so in February, do we see that seasonal factor again?
So we are seeing maybe a little bit of a change. So in this data, it is seasonally adjusted, which means they take out things that happen every year consistently so that we can understand the numbers being the same thing no matter what month they're in. Otherwise, you'd see, huge increases in November each year, big decreases in January. That generally gets taken out of the data. But when things happen only for a few years in a row, it doesn't always get taken out. It sounds like more people retiring at around this time is becoming a new thing that is not captured seasonally. But hopefully by next year or the year after, that will be stripped out of the data. The important thing, though, is that with a low unemployment rate and a very low underemployment rate, we are not seeing a great number of people looking for work and not being able to find it, or in work but not with enough hours.
Yeah, the unemployment rate remains steady at 4.1%. It's still very low by historical standards, and it suggesting the labour market remains very tight, as you alluded to. Now, it's one of the key factors that the central banks considers when making decisions on interest rates. Now, inflation has eased, but the labour market is still very tight. Does that mean that we won't get a rate cut next month when the board meets again?
With the mix of domestic data right now, it's very unlikely that we'll see a rate cut in the next meeting, which is in April. May is still a live meeting with a possibility of a rate cut, but on the balance of data right now, we don't think there'll be a rate cut in May either. The ANZ research forecast